So for the presentation of the etiologies, we have already said that what in the etiology you have traumatic spine injury, you have a patient that presents with traumatic spine injury, is it clear? Or you have anything like the acute of signs of cord compression, is it clear? In spondylodiscitis or spondylitis, if you have any sign of acute cord compression. Now, what are the signs of acute cord compression? The signs of acute cord compression are divided into three. The first is a compression of the cord, which is shown by the doorbell sign. Is it clear? Is the compression of the cord, which is shown by the doorbell sign. The second is the upper motor neuron syndrome. Upper motor neuron syndrome is below the lesion. Is it clear? You have upper motor neuron syndrome below the lesion. At the level which is below the lesion, you have upper motor neuron syndrome. And then you have signs of lower motor neuron syndrome at the level of the lesion. Because at the level of the lesion, we are thinking that the spinal nerves at that level are affected. Is it clear? So those are the three major signs that you have to visualize the acute cord compression, and that is what you're going to see in your patient. Is it clear? So if you have a patient that has local causes on the vertebrae, is it clear? You think of a vertebral disorder and you have these three major elements. You have the doorbell sign, you have upper motor neuron syndrome below the lesion of the spinal cord. You have the upper motor neuron syndrome below the lesion of the spinal cord, and you have the lower motor neuron syndrome at the level of the lesion of the spinal cord. Is it clear? And generally the causes we have already said. If you have pulse disease, the patient may have cough, pulmonary TB, which has become extra pulmonary. The patient may have the history of dispolar bending and all that. Is it clear? Based on the etiologies, because we have spondylitis, which spondylitis can be as a result of a metastasis from a cancer. Is it clear? So in somebody having, there are particularly 5 major cancers that can metastasize to the bone. The first cancer is a prostate cancer. The second is a breast cancer. The third is the thyroid cancer. The fourth is the lymphoma, and then the last one is the renal cancer. So those are the 5 major cancers that can metastasize at the level of the bones. Is it clear? So when you have a patient that has spondylitis, you can think of this cancer. Always do your DRE, always do a good breast examination to exclude the major cancers in males and females. Is it clear? So we have discitis again. You have the issue of bending, we have all that which can tell you disc prolapse and all that. So those are the different things. When you have spondylodiscitis, it is much more about disease. Is it clear? Spondylodiscitis is a good thing, but spondylitis is a poor thing. Every time you have inflammation of both the vertebral body and the inflammation of the disc, is a good thing.